You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Elder Care. For years, I have been helping families, medical providers, doctors, case managers, social workers, nurses find the right solutions for seniors in transition. Whether that is after a hospital stay, a rehabilitation stay, or when care needs at home have changed, we assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder care process can be, and I wanted to be a guide and a resource for both families and professionals. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with our families, clients, and providers. We create a customized care plan. When someone is needing more assistance at home and they're not able to stay home due to mobility needs or increased care needs, we provide them with options such as residential care homes, assisted living communities, memory care communities. We advocate, guide, and educate throughout the entire process. But most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Naeemah, I want you to tell us a little bit about you before we dive into this topic. I'd love for our listeners to get to know you a little better. Can you share a little bit about your background, your role, your credentials, and what inspired you to work in care transitions and skilled nursing?
Yes, so I'm a licensed master social worker. I initially, whenever I got out of school, I worked with adolescents, so my big focus was with children, but I had the opportunity to work alongside a hospital social worker in an internship, and that's what really sparked my interest in medical social work. I then did a couple of medical social work jobs, but then I landed in skilled nursing facilities, where now I'm here at Ignite Medical Resorts. So we do short-term rehabilitation.
Naeemah, let's talk about inspiration. What is your drive, your dedication for you to continue in this care transition recovery journey for patients and families?
So really, it was just seeing that our elderly population is so vulnerable. I think when we think about vulnerable populations, we think about children, and the elderly really are a part of that as well. They also need a lot of guidance and help, and so that really has been my driving force to continue in this field.
Naeemah, before we dive into skilled nursing facility, can you define what that is? What is a skilled nursing facility setting?
So skilled nursing facilities, often in this world, we call them SNFs. It's really a medical setting that provides short-term rehabilitation or long-term care for patients who really need some continued nursing support, usually after a hospital stay. So these facilities, they serve as a bridge between the hospital and home, offering physical, occupational, and speech therapy, as well as round-the-clock nursing care that involves some more complex things like wound care and IV treatments, with the goal really just to help the patients recover and regain their independence.
Let's talk about your role and your mission, Naeemah. I want you to share what does a case manager do in a rehabilitation or skilled nursing facility setting?
So in rehab or skilled nursing facilities, case managers are really seen as discharge planners, but truly we are brokers of resources. So our role is truly to guide the patients and the families on what tools and resources they can use post-discharge to make them successful at home.
And I see that it's not just at the beginning. You are a guide, an advocate, an educator every day, literally every hour that they're there, if they have questions.
Yes.
Naeemah, what does a typical day look like for you as a case manager?
So typical day, when I come in, I'm normally checking our reports to see who admitted the day before, so I can go and meet those patients, meet with their families. We do what we call a social service evaluation, and that's truly just to gather their discharge plan, learn what their support system looks like. We set up a care conference meeting so that we can set a good time that we can get together as a team to talk about the plan of care. Usually after around lunchtime, we're having some of those care planning meetings with families. And then we're also doing the heavy discharge planning, so coordinating services, follow-up calls, and that usually takes me throughout the end of my day.
How do you support both the patient and the families throughout the rehabilitation journey and stay at Ignite Medical Resort?
Really, it's answering their questions. They have lots of questions. This is a new environment. A lot of times they haven't been in a skilled nursing facility before. So our role is just to be there, answer all those ins and out questions for them.
Naeemah, when it comes to admission and stay, what does the admission process look like for someone coming from a hospital setting into Ignite skilled nursing facility?
Yes, so they're initially greeted by our hospitality team. Our team, hospitality, they orientate them. They give them a welcome booklet, list of good numbers, people that they can reach out to, different departments, because coming from the hospital is pretty disorienting. So we do that from the hospitality perspective. Then they're usually greeted with nurses and CNAs, doing evaluations by therapy. And then they also get a greeting from our team in care transitions.
How long is the average rehabilitation stay, and what factors determine how long someone stays at a skilled nursing facility?
So usually it's about 10 to 14 days. The biggest factor is going to be the insurance that is the payer of them being able to stay in the facility. But it also, is determined by, how quickly they can get to those goals that we have set, and how we can transition them safely home.
Naeemah, let's talk about care and outcomes. What types of therapy are most common in a setting like yours in a skilled nursing facility?
Most common is going to be the physical and occupational therapy. We do have a lot of guests that utilize our speech therapy services as well, but most common is going to be physical and occupational therapy.
How do you and your team at Ignite set realistic goals with families and patients?
That is definitely going to be from our initial care conference meetings. So those care conference meetings, we sit down with the patient, with the families. Care transitions is a part of that. So they have a case management representative, someone from therapy, as well as someone from our nursing supervising team, to kind of sit down, go over all aspects of their plan of care, redefine those goals, and make sure that we have a good outcome for this guest.
Mm-hmm. Good outcome, you mean a good discharge plan?
Yes, a good and safe discharge plan.
Yes. When it comes to family and support, what advice would you give families so that you're able to help their loved one recover successfully and avoid readmission?
It's really going to be doing some more in-person checks on their loved ones. What we hear a lot is that, I just talked to mom a week ago and everything seemed fine. But when they go to the house, it's a whole nother story. They start seeing different things. Maybe mom is moving a little slower. Maybe the fridge isn't stocked like they thought it was. So laying eyes on their loved one, I think, is really going to help people keep them home so that they can identify what barriers they may have with them being at home and make some adjustments.
Yeah, and I see that too in the work that I do with helping them move into care, assisted living or memory care. They don't see mom or dad until the holidays come or until there's a major event. So when they lay eyes on them, they realize that mom needs help with mobility or using the bathroom or the refrigerator's not as full. So you're right.
Or they're a little more forgetful. than what they remember them being. That's probably the biggest thing that we see is the forgetfulness, and you really can't tell that over the phone. You really see it when you're in person with them.
They're very good at masking or overcompensating for something that they're lacking.
Yes.
Yeah. What are some of the most common challenges that families face as they prepare to discharge home after they leave a skilled nursing facility like Ignite?
I think it's going to be when our families are presented with different resources to help them with their loved one at home. A lot of times those resources include having in-home caregivers. And the challenge that we see is the patient accepting that help. Yeah. They don't want to be seen as weak. They were very independent before, and now here they have their child what they call calling the shots on what's happening in their day-to-day life. So I think that's a big challenge, but that's where we step in,
right.
As staff and as medical professionals. We explain to the patients why we also feel like that's a good benefit for them, and hopefully they come around to that idea.
Yeah, they're more receptive hearing it from you, a professional,
yes.
right, or one of your colleagues than their daughter or their grandkids.
Yes.
Naeemah, let's talk about transitions of care. How do you coordinate next steps, whether that means going home or transitioning into assisted living or moving into a long-term care setting?
So that coordination really starts from our team, what we call an IDT, Interdisciplinary team. That's where we sit down and we review the guests every week. We go over how they're progressing, and in those meetings is when we identify barriers. And we may identify if maybe their original discharge plan is not the best plan. So if it's not, and we have to recommend a different setting, usually that's where we step in. We call the families. We either have another care conference meeting or just have a conversation with them. We present all the options to them. And whichever option they lean towards, then we deep dive into that process. So, whether that be connecting them with a placing agent, connecting them by giving them a list of facilities to go tour, giving them websites to look at reviews, basically taking away them just going home and jumping on Google to find the answer.
Mm-hmm. Because that's part of your job also, is to vet these companies and make sure you're following up and that
yes.
they're doing great when they're servicing your patients post-discharge. So
yes.
Whether that's home health or hospice or visiting practitioners, et cetera. Naeemah, what resources or referrals do you typically connect families to? And you mentioned some of that. How do you connect them with referrals after discharge?
So the biggest entity that we connect them to is going to be skilled home health. So that is a service that's typically covered by all of the insurance plans, where they can get a couple of visits of physical therapy, a couple of visits of occupational therapy, and nursing to come out to the house, check on them, work with them inside the home. So that is the biggest resource that we give them, is going to be that skilled home health. Other than that, we also give them options like hospice care or palliative care. A lot of times we learn that our guests have never been to the doctor or they haven't been in years, and they don't have a primary doctor to see and follow up with. So that's when we're connecting them to these in-home visiting physician groups so they can come in and get a visit and have a continuity of care when they're home.
And that's where your expertise in your IDT meetings, where you're with the therapy director and the medical doctor, where you determine who may be a candidate for whether it's home health or hospice, et cetera. Correct?
Right, exactly.
I want to hear a little bit about your insight and perspective, Naeemah. What do you wish more families understood about the role of skilled nursing and rehabilitation?
What I would really want them to focus on is the fact that skilled nursing is truly a transition. It's a transition in what the patient's life is going to look like. It's usually very short term, so you have to really pick up and make action in the very beginning. And I really want them to know that a lot of times their loved one is not going to go back 100% to their baseline, that there will be some minor changes that they have to make when they return home to make it more comfortable and more safe for their loved one.
Yeah, that's a hard conversation that you have, is educating them on setting realistic expectations, right?
Absolutely.
Because a lot of both patients and families think that mom is going to go back home and be able to do what she did. And here you have an
Absolutely.
80-year-old with a fall, and we know that that's not always the case. Most of the time it isn't. You have age going against you, and whatever ailment that they may have, it's hard to bounce back.
Right. I think the biggest one we see is adding some additional mobility devices that they didn't think they would have to use before. So sometimes that means going home using a wheelchair primarily. And, the families and the patients think, nope, my goal is I'm going to walk when I come out of here. Not necessarily,
Right.
So getting their mind wrapped around, okay, how can we make this adjustment and make it safe for home? Because our time at the skilled nursing facility is so short. So that's what we kind of foster with them.
Naeemah, let's talk about the patient journey. Could you walk us through a patient's journey from admission into discharge? What that really illustrates how case management makes a difference.
Yes. So the feedback that I normally hear from our patients is, gosh, there's just so many people coming in and out of my room. What happens is, they come in, there's nurses coming in, there's aides coming in, they're getting their vitals checked. They get their 3 meals a day. They get therapy sometimes twice a day. And so they're kind of moving and coming in and out of the room. And case management, we're kind of there as a constant. So they can call us if they need us. We can go to the room and visit them, answer their questions. Because for them, this is a weird kind of day-to-day for them, where they're used to being home and having their own routine. And now they've been thrown into a different routine in skilled nursing. So with case management, we're really there to help guide them and answer those questions about what is home going to look like when they leave our facility.
Naeemah, how is Ignite Medical Resort different from other skilled nursing facilities? What makes you unique or different at Ignite?
So Ignite is very hospitality driven. We pride ourselves in what we call luxury rehab. So we want you to walk into our facility and see that it looks different. The way that they're greeted is very different than traditional nursing homes or skilled nursing facilities. So our goal is rapid rehabilitation. We want you to come in, feel supported, and really kind of aid you in that recovery to your next transition home.
Yeah, I love the bistro. There is a lot of hospitality. I've seen it. Naeemah, in closing, and before we wrap up, I want you to share a story or a moment that truly defines why you do what you do, something that perhaps reminds you of the impact your role has had on patients and families.
Oh, yes. So a couple of months ago, I was checking my mailbox at work, and it's usually filled with a bunch of marketing material. So I was thumbing through all of it, and I saw this yellow envelope, and it was a letter. I looked at who it was from. I saw that it was addressed to me, which was odd, because usually it's addressed just to case management or just to Ignite. But it had my name on it. I did see who the letter was from, and I immediately remembered who it was. It was a sister to one of the patients that I had. So I opened the letter. It was a very, very sweet handwritten letter, which, in this day and age, having anything handwritten is I feel very valuable that they took the time to write this out. But this sister, I remember her like it was yesterday. I remember passing her in the hallway. She had this very nervous look on her face, and she kind of pointed at me, and she was like, are you the case manager? And I was like, yes, I am. Who's your loved one? And she told me her brother's name, and she's like, well, my brother is here. And she just kind of started rolling with questions, and she just looked very frantic. So I was like, you know what? Hey, let's go to my office. I take her into my office, and she just said, I just realized that my brother can't go home, and I don't know what to do. He doesn't have any kids. It's just me. It's always just been me and him, and what do I do? So I was like, okay, close the door. I told her to take a deep breath. I mean, she just looked very panicked. So we started talking about options and what we're going to do for him at Ignite, but also the options for post-discharge. We settled on a skilled nursing facility for long-term care as the best option for him. I gave her a list of facilities, and she left the office. But after that, we touched base about maybe twice a week after that, including a Sunday. And the Sunday, which is so funny, that she actually added that to the letter. She said, and even on that Sunday when I saw you in the hallway, I was working a manager shift. And so I was there and she saw me and she was like, I'm so sorry, it's a Sunday. I actually don't know why you're here, but I have a quick question. And I was like, of course. So I answered the question. We got him placed that next day and they discharged. So for me, that's a very typical case management that I do every day. But for her, it was incredibly impactful. She put it in the letter that just me touching base with her, my knowledge about what was going on, how to get him into a long-term care facility. She just said that it helped ease the process. And then, of course, she also put a tidbit about how well he was doing because he had been in the facility at this time for a couple of weeks. And that she was just very grateful for my guidance. And so stories like that's my why. Mm-hmm. That's my why. That's why I continue to do what I do. That's why I love care transitions, because it's scary. Yes. So I like being the person that can help handhold and guide them through this process.
Yeah, and I would define you as an educator, an advocate, a guide for all of these families and patients that you have served for so many years. And I want you to know that our community holds you in the highest regard. You are one of the most exceptional case managers, social workers that I know.
Thank you.
Just for the work that you've done. And I thank you for being here with us, Naeemah, and for sharing your perspective from a social worker's point of view. Now in your new role, and congratulations on that new role. Now in your new role as Vice President of Care Transitions for Ignite Medical Resort, you get to share the same expertise across 6 states for Ignite, mentoring and educating care transition and discharge planners so that they can successfully support families and patients throughout discharge and help them return home safely or back to their assisted living. What is your wish? What is your goal in this role for all of those that you are guiding and that you are overseeing for your case managers, discharge planners?
I just want them to realize that they are true advocates. Everyone in the facility is an advocate for the patient, but with care transitions, I mean, we are like the bread and butter when it comes to advocacy. We're doing certain things like advocating with the insurance, advocating by sometimes having those mediation family meetings, and we're the one going between the patient and the loved one and coming to a common ground on what their plan's going to be. So I just want them to know how pivotal and important their role is, and that they really are change makers.
Yeah, and that word advocate is so loosely used, but that is what you really do. You truly are an advocate, and it's I'm so proud of you to see you now in this role. You're able to impact so many discharge planners and case managers. And again, thank you for being here with us today. Naeemah, how can families, listeners get a hold of you if they have a question about Ignite Medical Resorts or skilled nursing facility?
Yeah, so I think the best thing to do is to call our admissions department. They'll be able to walk anyone through qualifications to come to one of our Ignite facilities. What I will do is I actually will go ahead and give you the phone number to our Ignite San Antonio admissions department. That phone number is going to be 210-642-53
Thank you.
Thank you so much.
Yes, thank you again, Naeemah. And I thank you for joining me on Navigating Eldercare, where we bring guidance and answers for every step of the eldercare journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in health or planning for future care needs, Care Advocates is here to help you find the right care at the right time. Please know that our services are no cost. Whether it is assisted living, memory care, or bringing trusted resources, community resources into your home, we walk alongside you every step of the way. Our commitment is simple: care, compassion, and lifetime support. For a free consultation, call me at 210-669-2222. Be sure to subscribe, like, and share this podcast, and visit us at advocatern.com for helpful resources. You can also listen to past episodes on YouTube or listen on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Eldercare, helping you find the right care at the right time for the people that matter the most. Thank you so much for listening.
This has been Navigating Eldercare with Laura Daniels, providing guidance and answers for every step of the eldercare journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com. When a loved one needs care, the decisions can be overwhelming. Laura Daniels, founder of Care Advocates, helps families and medical providers find the right eldercare solutions, from hospital discharge to assisted living and beyond. She's your trusted resource for smooth, stress-free transitions. Join her each week for Navigating Eldercare, Sundays at 8:30 a.m. right here, where she shares expert advice, real-life solutions, and interviews with professionals who care. Need help now? Call 210-669-2222 or visit advocatern.com.